Hello, and welcome everyone to Talk to Tony Wilson. I'm going to start with a recap from our last video where we talked about immunity. I left a trivia question. That question was, what does RBC and WBC stand for? And if elevated, which one signals a possible infection? For those who got that question right, congratulations. And for those who did not, congratulations for taking steps to try to understand your health. So, to answer the question of what are RBCs and WBCs, we'll start with RBCs. RBCs are red blood cells that carries oxygen to body tissues. A high level of RBCs may result from conditions that causes low oxygen levels in the blood, such as sleep apnea and pulmonary fibrosis, which is scarring of the lung tissues. Neither one of them sounds like an infection. So, if RBC or red blood cell was not the right answer, the other option was WBCs, which are white blood cells, also known as leukocytes. They are our body's defense system against infections. So when you go to the doctor and you're looking at your results and you see your WBCs, you'll see what they call a within normal limit range. That range is usually somewhere around 5,000 to 10,000. For those numbers that are over 10,000, that's when the doctors will consider whether or not you actually have an infection. Sometimes those numbers are a little high just because you're stressed. The WBCs can be broken into different segments, and I'll tell you about 3 of them. Those are called the neutrophils, the basophils, and the eosinophils. The neutrophils are what we call the free travelers. They're the first responders. So when there's an infection that invades your body, the neutrophils are already there trying to attack that infection. All the while, they're sending signals out to the eosinophils and the basophils. The eosinophils will take effect if it's an allergic reaction. The basophils, they come into play. They try to encapsulate that particular virus or bacteria or infection and try to destroy it. Okay, so we have talked about WBCs and their role in infections. We talked about breaking the chain of infection. We've talked about COVID-19 and the signs and symptoms of COVID-19, such as the cough, the fever, the sore throat, the nausea, some vomiting, congestion. But what are some other signs and symptoms of infection? Because there's more infections out there besides just COVID-19. And that's going to be our trivia question. Besides COVID-19 and COVID-19 symptoms of the cough, the fever, congestion, sore throat, runny nose, what are some other signs and symptoms of infection? All right. So leave me a response either on my Facebook post, my YouTube channel, or through Messenger. Either way is fine. So again, this concludes another Talk to Tony Wilson. And to all I will say, have a great day.